Yeah, am I audible and visible now? The app users and the YouTube live audience here, a quick nod whether I am audible and visible now. No, actually I'd stopped the stream because it was not getting streamed properly on YouTube, but I think it should be better now. Yes? All right, that's great. So happy evening, everyone. A very good evening, and welcome to the today's live session. Basically, we have we have KBMD Pharmacology today. All the questions are your Pharmacology PYQs, right? So your target should be basically to get all the questions right, because this is all PYQs based. So the questions are not, like, I would say, very difficult, and particularly the PYQs are from the FMGE exam, right? So this is useful for everyone out there. So your target is to get all the questions right. The in-app subscribers, the in-app users, this class is being streamed in app and also on YouTube. The in-app users will have the advantage of answering in the poll and looking at the leaderboard, getting your ranks, live ranks as well. Right. So today we had another live session in app where we discussed the PSM and surgery topics. And I'm sorry, someone of you had asked in app live, like, how to stay motivated, and that's something I told ki mujhe aakhir mein yaad dilana. We'll talk about that, and I actually forgot talking about that. So that's what I realized later after the class, and that is why that is something that I will be starting with in the today's class, and that is about how to stay motivated, guys. So remember that this is a very beautiful quote that you should always remember, and that is, if you are bored with life, you don't get up every morning with a burning desire to do the things, you don't have enough goals, right? Such a powerful quote, right? This is such a powerful quote which tells you that suppose, let's say that in the morning you are not very excited to wake up and complete your daily targets. Probably that's the reason that you have not defined your goal, and probably you are missing that burning desire. Just having a desire, okay, I want to get into this branch and this college, is just one desire. Another thing, I want to and I will get into this branch and this college by hook or by crook. So that is something which is like burning desire, right? So most important things, it is said that you should be writing down your goals, because that gives you a direction, and that gives you an indication of how much hard work more is required to reach to your goal. So this happens, the lack of motivation generally happens when our goals are not defined. Why our goals are not defined? Because we don't have a burning desire. Probably we are just in the rat race because everybody else is preparing for PG entrance, so are we doing that? So if you are doing with that intention, you will lack that motivation. Yeah, if you will do with the intention that learning from the best institute and being the best, like a renowned doctor, whose opinion everybody would be seeking, is something that can give you a burning desire to do those things, right? Yes. Sound में echo आ रहा है. YouTube वाले बच्चे बोल रहे हैं, is it echoing? Yeah. Okay. So, and the next one is a great news that we have for all of you. So we have launched a short accelerate. So basically for the students who are the students who are appearing for the upcoming FMG exam and the NEET PG exam. So we have launched a 1 month plan and a 3 month plan, basically till your 25th January until 10th March. So this is just an introductory offer of the short accelerate. The prices are valid only for the next 2 days, right? So what will the short accelerate include? The short accelerate basically will include your short 5.0, जो book आ रही है in the next week. The short 5.0 book will be available. So all the topics, the videos are available in that, right? So that is around your 313 topics, like more than 300 topics, the core topics from all 19 subjects except radiology, because radiology you would see me on prep ladder, right? And you would be asking me, so what is different? We are getting all the 19 subjects, rapid revision, quick revision, last minute revision, everywhere. So why should we be using that? Because each topic has been simplified in a way that you retain it even if you don't revise it later. So each topic is full of mnemonics. Trust me, that will help you for effortless recall in the exam hall. And the KBMD. So someone was asking what is KBMD? KBMD is कौन बनेगा MD. इको आ रहा है? अभी क्यों इको आ रहा है? अभी तो मैंने बंद कर दिया इको. I don't think it should be echoing now. नहीं ना, इको ठीक है, क्योंकि मैंने कुछ चेंज नहीं किया तो इको नहीं होना चाहिए. ठीक है. हाँ. So what I was saying is, so KBMDs, those are basically your MCQ discussions, because trust me, developing those MCQ skills is another skill that you need once you finish your theory and learning the topics, right? Why do many students, in spite of putting so much hard work, are not able to get a good score or a good rank? Is because they have read the theory, they have read the notes very, very well. But how to apply that when it comes to MCQs is a different skill set that is required. So that is why we'll be focusing on both of this in Short Accelerate course. Okay, so it's basically the short course with a shorter duration, 1 month and 3 months, that is available. Now the major query that I'm receiving is, you will not see on the app directly. You will see that 4499 wala ya 5185 wala, and in the app you will have the option of buy now. Once you click on that, then you will see the 1 month and 3 month plan that will be visible, right? Click on buy now and then you'll be able to see the 1 month and 3 months plan, right? Okay. No BJ Medical, no plans so far. इसमें से फुर्सत नहीं मिल रही है. ठीक है. Yeah, the Short 5.0 also has the offline class recording that I recently conducted for Short, plus along with that the app recorded classes as well. ठीक है. नहीं, Shravya. So please watch the Shravya if you find Pharmac as your weakest subject. Watch the videos which are available here on Medsynapse. Start with Short 5.0 videos and then the extra topics you can go ahead with that. Okay? Yeah. So let's start with the discussion of our MCQs. The first question here, all of these questions, like I said, are the FMGE PYQs. NEET PG students, you need to solve these as well. Right? चलो. पुष्पेंद्र, अगर वो realistic होता तो मैं ज़रूर कर लेती. Right, there are a lot of things, lot of expenses that go behind running the app, the recordings and the live classes, right? So I think we have kept it as affordable as we could. Therapeutic index of a drug is an indicator of. So all these PYQs will revalidate the fact that mnemonics will help you answer the questions. Okay, absolutely right. So therapeutic index is an indicator of safety. Right, it's an indicator of safety. A quick revision of therapeutic index ka formula. I hope everybody remembers the mnemonic TILE. So it is TILE. It is LD50 by ED50. Lethal dose by effective dose. Lethal dose in human beings is replaced by the toxic dose, because in humans you do not wait for the death to occur. So it is TILE. Therapeutic index is LD50 by ED50. Narrow therapeutic index means the drug is unsafe. Okay, narrow therapeutic index means the drug is unsafe. Sorry, I forgot to start the poll. The app users, मैं poll वापस start कर दूँगी. ठीक है, next question में start करूँगी. So remember that therapeutic index of a drug is an indicator of safety. If you know the mnemonic for potency and efficacy in the dose response curve, everybody, yeah? Yeah, so what is efficacy, what is potency wala mnemonic? Remember the mnemonic help? The height indicates the efficacy, the left one is the potency. जिसका height is ज़्यादा वो efficacious, वो जो left है वो potent है. Right, I'm great to see all of you know the mnemonic there. ठीक है? So this is basically your help mnemonic. Going on to the next question, a very, very easy one. Yeah, this is very easy. Now I'm starting the poll in the app. Please answer मत करो chat में, poll में answer कर लेना. Healthy volunteers are recruited in which phase of clinical trial? I want 100% students to get this right. I can see 82% getting this right. Yes, and Alright, let's see the leaderboard. Sharika is leading, then Ravi, Garvita, Dr. Ronaldo on the top 4 positions is what I can see. So healthy volunteers, of course, is your phase 1. Clinical trial that starts with your phase 1. We start in healthy volunteers. Phase 2 is small number of patients. In phase 3, remember very important question, 3-letter RCT, randomized controlled trial, where basically we are comparing with the older drug, is in phase 3. And here you have the post-marketing surveillance in your phase 4. Okay. So remember, this is what we have. That is your phase 1. Where's the poll in the app? You would see it in the app, right? Whoever is using the iOS, try to use the poll in the landscape mode or the portrait mode. Try changing that. It helps, I believe. Yeah. Poll, Sushmita, is available in app for in-app users only. Okay, not on YouTube. Yeah, you are able to see that. Chalo, going on to the next question. Which of the following drug? Let me create the poll. No answers in the chat. The app users. Yeah, just creating a poll for you guys and you will be answering in the poll right away. So, which of the following drug is not metabolized by acetylation? How many students are getting this right? 56%. This is just a twisted question that we have already seen. Right? Remember this? Yeah, very correct. It is B. Why the answer is B? Because the drugs metabolized by acetylation, remember, if there are slow acetylators, what is the side effect that we are worried about in slow acetylators patients? We are looking for drug-induced SLE. Okay, that is drug-induced SLE. And drug-induced SLE is what drugs? It is SHIP. Sulfonamides, hydralazine, INH, and remember the P is the procainamide. It is not procaine or not phenytoin. So remember, it's not phenytoin. Isoniazid hai, hydralazine hai, procainamide hai. So next time if you get a question, which antihypertensive drug can cause SLE? That is hydralazine. Prashant, so depending on whether we have discussed the topic, it's easy question or difficult question, I'll be changing the time of the poll. So where I think, this question should be answered in 15 seconds, I'll give you 15 seconds. Where I think it's 30 seconds, 60 seconds, then I will increase. Grumpy, be happy that you've made the mistake in the class so that you will not make this mistake in the exam. That's the whole purpose of these sessions. So make as many mistakes as you want in the class, right? So that you remember it and you don't make the mistake in the exam. Okay. And in drug-induced SLE, remember the antibody is antihistone antibodies. Okay. You look for antihistone antibodies. The mnemonic is we look for drug history. Okay. We look for drug history. Yeah. Dapsone as well. Dapsone is basically a type of sulfonamide, right? So it will come under that, right? So remember this is just a twisted question. By rather than asking which of the following drugs will not cause SLE, instead of that the question is asking which of the following drug is not metabolized by acetylation. That means the same thing ki drug induced SLE kisse hota hai. ठीक है? Okay, going on to the next question and let's discuss this. We have discussed this in short 5.0 as well. Okay, so I am starting the poll for you guys. I don't want only 70% students to get this right. Yeah? It's a very frequently repeated question. Only 64%, short 5.0 देख लो, अच्छे से देख लो. Yeah, very good. The YouTube users, the app users, I can see the percentage here in app, but not on YouTube. Okay. Right. Let us see the leaderboard. Sharika is leading, then Ravi, and then Garvita. Okay. Sharika maintaining the lead. Now, these are the types of questions that you should be expecting in your FMG exam and NEET PG exam also. That means they are clinical questions, but just like 2-3 liners, इतने बड़े बड़े नहीं होंगे, बहुत ज़्यादा बड़े जैसे USMLE जैसे इतने बड़े नहीं होंगे, but ऐसे questions पक्के होंगे, right? I've given the NEET PG myself recently, so I can tell you from that. Okay. So remember that rather than asking a direct one-liner question, they put it in a clinical format. So when I say it is clinical questions, don't be under this misconception कि भाई मतलब अभी mnemonics और facts और रट्टा मार वाला कुछ काम नहीं आने वाला है, ठीक है? So please remember that. Leaderboard is not seen. Were you able to see the leaderboard previously, guys? Vibin, Navin, पहले दिखता था leaderboard? Yes, Kuntas. Yes, Kuntas, plan तो जरूर है, देखते हैं. ठीक है, अगर अभी leaderboard नहीं दिख रहा है, so I will definitely update the tech team about this. Okay, so there must have been some update that might have happened, and that's why this is happening. Okay, so next time that should be resolved. Okay, so whenever you have these clinical questions, read from the last line. Which of the following drug can be used to prevent neutropenia in the next cycle of chemotherapy? Do you think I need to read the first 2 lines here? No, the last line is enough to help me answer the question. This is how you save time in the exam. So anybody who's facing time management issues in your grand test and mock test, use this technique. In your lengthy question, start reading from the last line, then the second last line. And if then also you're not able to answer, then go to the first line. Okay. So neutropenia prevent करने के लिए it is filgrastim. In pharmacology drugs, try to decode the spelling. Filgrastim. Grastim is your granulocyte stimulator. Okay, so basically this is a stimulator of granulocyte. Are the neutrophils included in granulocytes? Yes, right. So basically this is GCSF, the granulocyte colony stimulating factor. That is what is your filgrastim. Versus you have another drug which is filgramostim. Okay, when it is filgramostim, that means it is granulocyte and monocyte stimulator. So it is GMCSF. Okay, that is going to be GMCSF. So next time if they tell you the neutropenia and also the monocytes or macrophages, then it is your gramostim. Okay, remember gramostim. Okay. How was the score in NEET PG? Yeah, so NEET PG 21, I got a score of 640 with All India rank of 600. And NEET PG 23, it was a score of around 590 with a rank of around between 2K or 3K. Okay, so I've given those 2 exams. Now, Sunny, the Shortshot 5.0 price, if you're taking for 9 months, it is 4499. If you're taking for 3 months, it is 1999. So, depending on the duration. Yeah, it is sargramostim. Okay, sargramostim. And remember the question for thrombocytopenia, your recent NEET PG exam question. So, do you see how the FMG PYQs are repeated in NEET PG? It's the topic which is repeated. It's not the question which is repeated. So, this NEET PG 23, it was a question कि thrombocytopenia है तो फिर कौन सा drug देंगे? Thrombocytopenia hai, very good. Then it is oprelvecin. Okay, then it is oprelvecin, right? So remember the trick, it is 0 platelets mein. We give oprelvecin, 11 interleukin is what is oprelvecin. 11 LV and kin, 11 interleukin. It is interleukin 11 used in 0 platelets, that is thrombocytopenia. Okay? Alright, going to the next question. What do you think would be the answer to this one now? What drug is contraindicated in pregnancy? What drug is contraindicated in pregnancy? We have discussed this as well in Shortshot 5.0. Drugs safe in pregnancy, drugs contraindicated in pregnancy. ये 54% सिर्फ कैसे यार राइट कर सकते हो? Everybody needs to get this right. You cannot make these questions wrong. Okay? Yeah. Let's see the leaderboard. I'll tell you from the leaderboard. Okay? So now Varun is leading, then we have Sharika, and then we have Ravi. Okay, so Sharika is to the second position now. Drug contraindicated in pregnancy ke pehle tell me the drugs, the antimicrobial safe in pregnancy. Remember PCM drugs, that is your penicillin, cephalosporins and macrolides. Okay, it is penicillin, cephalosporin and it is macrolides. Remember, it is not chloramphenicol. C is not chloramphenicol, it is cephalosporin. Erythromycin is a macrolide. Okay, erythro is a macrolide. So it is safe. Many of you answered in the poll I saw is erythromycin. This is a penicillin, so this is safe. This is ceftriaxone, cephalosporin, so it is safe. PCM, right? So what is unsafe is streptomycin. Remember streptomycin. Yes, streptomycin is basically a aminoglycoside. Okay, streptomycin is an aminoglycoside. And remember aminoglycoside, NO. Remember this, the mnemonic I've told you in short 5.0. The baby says to the mother, amino, amino, that is amino, don't take this drug. Okay, so remember it is amino, that don't take this drug. Yeah, amino, amino. So NO, it is nephrotoxic and it is ototoxic. Okay, it is nephrotoxic and ototoxic. See, when you have two answers which can be correct, you always have to choose the better answer. Okay, you always have to choose the better answer, and without a doubt the answer here would be your streptomycin, which is an aminoglycoside. Okay. Yeah. Yes, Aishwarya, absolutely. You should prefer practicing FMG PYQs over the AIIMS PYQs for NEET PG exam. So the sequence should be first the NEET PG PYQs, then the FMG PYQs, and then the AIIMS PYQs. Right? You would see a lot of overlap in the FMG and NEET PG questions. Okay. Yeah, going to the next one, right? This again should be an easy one. What do you think would be the answer to this one now? Which of the following drug is a protein synthesis inhibitor? क्या कर रहे हो 43% राइट ऐसे कैसे चलेगा रीड द क्वेश्चन वेरी करेक्टली प्लीज डोंट मेक सिली मिस्टेक्स हियर I think many of you have made a silly mistake here. Only 41% right हो ऐसा हो नहीं सकता. You know, I can't believe that. So 44% have got this right. In app is what I can see. Varun is leading, then Ravi and Garvita. Yeah. It is not a protease inhibitor. इसीलिए बोलते हैं कि कोई भी क्वेश्चन अच्छे से पढ़ना. Don't read it with any pre-bias or pre-notion. Yeah, it is not mentioned. Protease inhibitor. Indinavir is a protease inhibitor, and the examiner is very smart. Deliberately, the first option kept is indinavir. क्योंकि पता है कि बच्चे फटाफट पढ़ के protease inhibitor पढ़ के indinavir मार्क कर देंगे. Please don't make that mistake. I don't want anybody of you to lose your marks on these silly mistakes. Right? So remember, indinavir is a protease inhibitor, not a protein synthesis inhibitor. Right? So protein synthesis inhibitor, remember 30S and 50S inhibitors bind at 30, cells at 50. So aminoglycosides tetracycline is 30S. Your chloramphenicol, erythromycin, linezolid, your lincosamide, clindamycin, streptogrammin, all that is your 50. Okay. Nevirapine, remember given in the neonate, that is NNRTI. Very good, Rekha. That is NNRTI. Linezolid is a protein synthesis inhibitor. It binds to your 50S, the 28S subunit of 50S, and it inhibits what step in the protein synthesis? It inhibits what step in the protein synthesis? Is it initiation? Is it elongation, or is it termination? It inhibits the protein synthesis initiation. Very important. We have discussed this again in 5.0. Short 5.0. Linezolid is initiation inhibitor. Right? Remember some peculiar side effects with linezolid. What are those? Even this has been asked in the previous exam. What is that? It is a MAO inhibitor. Linezolid is a MAO inhibitor. It can cause optic neuropathy as well. Okay? It's a MAO inhibitor. Remember that. This has been asked previously. Okay, ceftriaxone. What's the mechanism of action of ceftriaxone? Is it a protein synthesis inhibitor, cell wall synthesis inhibitor, plasma membrane synthesis inhibitor? What is the mechanism of action of ceftriaxone? It's a beta-lactam. Very good. It's a beta-lactam. So remember the story of beta asking for cycle, Ford, when, bus. It is a beta-lactam which is cell wall synthesis inhibitor. Okay, cell wall synthesis inhibitor. Right? Please remember the entire subject of pharmacology with mnemonics. That will help you retain it in a much better way. Okay? Yes. This we have already discussed in short 5.0, the various drugs, the antimicrobials and their mechanism of action. Going to the next one. This is your next question. And tell me, what do you think will be the answer to this? I'll start the poll. Again, a topic that we have discussed in short 5.0, diabetes mellitus drugs. Great. 71% are getting that right. Yes, I can see the YouTube users as well are getting this right. So I can see 59% getting this right. Let us see the leaderboard here. Very good. We have Varun leading, then Ravi and then Garvita. Okay, that's what the leaderboard says. Mechanism of action of exenatide. Remember the mnemonic for exenatide? Shruti, in the respective apps, whatever will be the primary apps that you are using for your preparation, they have the FMG previous year questions as well. Okay. Yeah, exenatide. Very good, Dr. Mohak Shah. The mnemonic is, it increases, it leads to the tide of insulin coming out from the pancreas, right? So basically it is increasing the insulin release, tide of insulin, right? So which is the option which is telling you the release of insulin? It is your option 4 itself. Now remember that next time if the option says release of insulin by blocking the potassium channel, then what drug will it be? Release of insulin by blocking the potassium channel, those drugs would be sulfonylureas. But here, release of insulin by acting as GLP-1 agonist, right? So remember that this is your exenatide. No, Uzma, the YouTube live video will be available only till it is live, okay? So exenatide leads to the tide of insulin by acting as GLP-1. Yes, very good, Naveen. Option 1, inhibition of DPP4 is an enzyme which degrades your GLP-1. So this is basically your gliptins, GLP-1 inhibitor. Gliptins, GLP-1 ka inhibitor nahi, degradation ka inhibitor. That is gliptins. Inhibiting the intestinal absorption of carbohydrates. What drug is that? Very good. That is acarbose. Acarbose. A matlab no, carbohydrate matlab no carbohydrate absorption. Right? And stimulation of PPAR gamma. What is your PPAR gamma? The TZDs, thiazolidine diones. That is your rosiglitazone, pioglitazones. That basically is your glitazones. Gamma is your glitazones. Okay? And remember PPAR alpha drugs. Alpha is related to your fatty acids. It's related to your fats and that is fibrates. F for fats, F for fibrates. Very good. You remember that? That's great. So remember fibrates basically decrease your triglycerides. They are used in hypertriglyceridemia. Another important point, do you combine fibrates with your statins? Do we combine fibrates with statins? No. Why should we not combine fibrates and statins together in a patient who has dyslipidemia? Because it will increase the myopathy caused by statins, right? It increases the myopathy caused by statins. Okay, so very, very important. Even this is a FMG PYQ that has been asked previously. Okay, yes, gamma is glucose, alpha is your fat wala fibrate. Okay. So this is your table basically from the first aid. The diabetes drugs which act by increasing the insulin secretion is your sulfonylureas. They act by potassium channel blocker. Remember, not opener. When you block the potassium, the calcium comes in and that releases the insulin. Okay, blocking the potassium leads to cell depolarization. Remember that. Okay. The side effect, it can cause disulfiram like reaction. Disulfiram like reaction is common with your first generation sulfonylureas. So disulfiram is your first generation. Because of the insulin release, they can cause hypoglycemia, and remember, they will cause weight gain. When they are increasing the insulin, they are causing anabolic effect and causing the weight gain. Sulfonylureas cause weight gain, metformin causes weight loss. Okay. Next one are your glitinides also, meglitinides. They also increase the insulin release. Meglitinides, that's another drug. Okay. Increasing the glucose induced insulin secretion, that means after we are eating. So here comes the role of GLP-1 analogs, the tides here, exenatide, liraglutide, and the DPP-4 inhibitors, that is gliptins. Remember these drugs which are basically glucose induced wale, they increase the satiety. Okay, these are the drugs which increase the satiety. That means the patient's tummy gets full early, right, and the patient does not eat much. Okay, and that is why there will be the weight loss, not the weight gain. Even if they are increasing the insulin, but they are increasing the satiety as well. So remember, this will cause weight loss, not weight gain. Okay, yes. The other side effects we have already seen. Yes. Yeah, very correct. Mildly cute. Nicorandil is your potassium channel opener. When I write Nico, remember Nicorandil. KO helps me to remember that it is a potassium channel opener. Okay, it's a potassium channel opener. Okay. Yes. Going to the next one another question on diabetes mellitus drug. I am starting the poll here. What do you think would be the answer to this one? In the management of diabetes mellitus, lactic acidosis is caused by? In the management of diabetes mellitus, lactic acidosis is caused by? So 75% students have got this right. ऐसी गलतियाँ मत करो, something which we have already discussed. I feel very bad if you make that wrong. So Varun is leading, then Ravi and Garvita, constant leaderboard here. Lactic acidosis basically is metabolic acidosis, which is HAGMA, high anion gap metabolic acidosis. So remember, metabolic acidosis, met for met, is caused by metformin. Remember the other side effect with metformin? One is metabolic acidosis and another is met for met. It causes your methyl cobalamin deficiency, vitamin B12 deficiency. So next time they tell you whether there is a megaloblastic anemia in a diabetic patient on treatment, it is metformin. Right, so methyl cobalamin and metabolic acidosis. So remember, it is metformin. Okay, it is metformin. What does Shruti? So remember the concept. All these are PYQs. All these are PYQs, right? How to remember which drugs lead to weight gain and which lead to weight loss? So remember, basically the drugs which are increasing the insulin, they cause weight gain. But the exception here, your GLP wale drugs, the tides and the gliptins, because they are inducing satiety, so that's how they cause weight loss, even though they are increasing the insulin. Okay? And the pioglitazone. Pioglitazone causes what cancer? Pioglitazone causes what cancer? Very good, little step ahead. Pio is peeing. Okay, peeing is via the urinary bladder. We pee from the urinary bladder. So remember, it is a drug which can cause urinary bladder cancer. Versus your rosiglitazone. What side effect do we see with rosiglitazone? Rosiglitazone causes what side effect? Very good. Yeah, so I think all of you remember this. So rosiglitazone, remember on a rose day, the Valentine's Day, that is when the maximum heartbreaks occur. Yeah, on the rose day, on the Valentine's Day, maximum heartbreak, that is MI. Okay, that is MI. And the common side effect with this thiazolidine diones is they cause fluid retention. Okay, they cause fluid retention and therefore they are contraindicated in heart failure. Okay, they are contraindicated in heart failure. Very, very important. Okay. So, pioglitazone, remember the glitazones is your PPAR gamma. So, they increase the insulin sensitivity. Basically, that is the mechanism of action. And they also increase adiponectin levels. They cause weight gain, edema, fluid retention, heart failure. Right. Someone was asking where are the fractures? Right. So, remember increased risk of fractures is also with your glitazones. Right. So, remember Rosie is a female and females में fracture common होता है. Postmenopausal female estrogen जाएगा. So, you can remember fractures is there. Okay. Metformin is lactic acidosis. So, you have to use very cautiously in renal insufficiency and vitamin B12. Remember it causes weight loss. Important. Okay. Everybody is clear with this? Metformin inhibits your gluconeogenesis also. Remember by inhibiting this, mitochondrial glycerol 3-phosphate dehydrogenase. So, next time if you get this question, which drug, anti-diabetic drug inhibits your MGPD? So, remember mitochondrial wala is your metformin, the mitochondrial glycerol 3-phosphate dehydrogenase, because your glycerol is basically your substrate for gluconeogenesis, right? Remember glycerol is a substrate for gluconeogenesis. Okay, this YouTube video will not be available later, Uzma. Like I said, it is for in-app subscribers. Just when it is live, it is being streamed on YouTube. Yeah, so Dr. Harshraj, is Medsynapse sure shot sufficient to get into the college? See, let me answer this question. Medsynapse is like a core, okay, that is like a must do. So, like I said, if there is a ladder, the first step that you have to do is the sure shot, right? Start with sure shot 5.0 if you are starting using Medsynapse now. You will find it in the sure shot accelerate folder in the app. So, सबसे पहले उससे start करो, finish all 19 subjects, give a grand test and see whether your scores have improved so that it would validate whether it is actually helping you, right? So, if you are a student who is just looking कि मेरे को तो सिर्फ exam qualify करना है, then stick to sure shot and the KBMDs, okay? But if you are a student who is looking for some great ranks, so if you are at this level, the sure shot and the KBMDs will take you to this level. So, they will definitely give you an extra edge. So, basically the point here, no matter what is your target, no matter what level of preparation you are, the sure shot and the KBMD is definitely going to help you, okay? Yes, Dr. Aspiring, I'll be coming up with that as well. No, Nitya, the subscribers don't have to pay for the new Accelerate course. The new Accelerate course is basically a part in the short shot main course itself, okay? So, you don't have to subscribe, it separately. Now, Dr. Aspiring will be doing a lot of KBMDs now in app itself. Answer mark Mahalakshmi, the YouTube users don't have the poll option. It is for the in-app users. Okay, I hope I've answered. When will the book be available? The book will be available in next week. Okay, it will be available in next week. Yeah, let's go on to the next one. Yeah, easy one I would say, just that the question has been put as your basically your clinical question. Yeah, this should be easy one. Weight loss. Ishmit, it is weight loss. Yeah, Hetal, no matter even if you've been using another resource so far, short, Medsynapse is complementary to your previous resource. It is not replacing your previous resource, but it is actually helping you retain the previous resource ka information. Yes. So, let's have a look at the leaderboard. Varun leading, then Ravi and then Garvita. Very good. So, patient developed dry cough. Which of the following drug is responsible? Hypertensive patient. Remember, it is ACE inhibitors. The mnemonic itself is ACE. So, ACE inhibitors, they cause cough and edema. What edema? The angioedema. Why do they cause this? Basically, it is because of increased bradykinin. Because ACE degrades your bradykinin. So, if you are blocking that, inhibiting ACE, the bradykinin increases. So, therefore, if this occurs, the next question is, you should replace the ACE inhibitor by ARBs, the angiotensin receptor blockers like losartan, telmisartan, right, the sartans. So, replace them by ARBs. Why? Because ARBs are just blocking the receptors. They are not inhibiting the ACE. So, the bradykinin will not increase. Okay, the bradykinin will not increase. Also, tell me the side effect of ACE inhibitor. Will it cause hypokalemia or hyperkalemia? Will it cause hypokalemia or hyperkalemia? Yes? Iron Man? Nahi. Please a galti mat karna. Very, very important. It is hyperkalemia. ACE inhibitor, any drug, anything which is your RAS inhibitor. Renin, angiotensin, aldosterone inhibitor. Example of aldosterone inhibitor, spironolactone. So, do you not read spironolactone in your potassium sparing diuretic? That means it increases potassium, right? So, remember, anything which is inhibiting and antagonizing the RAS system is your hyperkalemia, not hypokalemia. Okay, it is hyperkalemia, not hypokalemia. And therefore, you also see hyperkalemia in RTA type. Which RTA type is your aldosterone antagonism, aldosterone deficiency? Remember, in RTA type 4, potassium is more. Recently asked question. RTA type 4, galti mat karna isme, right? Many times we have discussed in short 5.0 again and again. It is RTA type 4 where the potassium is more. Okay, in RTA type 4 where the potassium is more. Okay. Right, so that was about this question. Going to the next one, and a very easy one. The drug of choice for PSVT is? What is the drug of choice for PSVT? Great, 84% getting this right. It has to be 100%. Okay, 100% getting this right. Yeah, let's see the leaderboard. Varun maintaining the lead, and then is Garvita, and then Dr. Deeps. Yeah, it is adenosine, which is the drug of choice for PSVT. Please tell me the ECG findings of PSVT. Is it a narrow complex QRS or a broad complex QRS? Next time they can give you a clinical question rather than a one-liner. Yeah, it is narrow complex QRS. Okay, it is narrow complex QRS. I hope you understand the concept of ventricular tachycardia is broad complex. When the tachycardia is coming from the ventricle itself, that is not from the SA node, it is abnormal pathway. Any abnormal pathway is broad QRS. When the tachycardia is supraventricular coming from the SA node, then it is narrow complex. So, supraventricular is a narrow complex QRS. Right, here is the P wave absent. Can the P wave be absent here in PSVT? Yes or no? Can the P wave be absent? Yes, with P wave is absent. राइट. रिमेंबर दैट P wave absent मतलब हमेशा atrial fibrillation नहीं होता है. So how do I differentiate the, because the P wave here it is camouflage, it's hidden in the QRS itself. The P wave is hidden, that's why it's not seen. So how do I differentiate this absent P wave from atrial fibrillation? Remember, the rhythm in PSVT is a regular rhythm. Okay, it is a regular rhythm. In your atrial fibrillation, it is your irregular rhythm. Okay, in atrial fibrillation, it is irregular rhythm. That is how the question will help you differentiate. Okay. So this is adenosine is the drug of choice. Adenosine is what class of antiarrhythmic drug? It is a class 5. It's a miscellaneous antiarrhythmic drug. It basically delays the conduction through the AV node. It is class 5. Okay. How is adenosine given? It is given IV. How much dose? 6 milligram IV. If there is no response, then we give 12 milligram. If still there is no response, your INICT question previous, then what do you give? If still there is no response, then you give either calcium channel blocker or a beta blocker, because both of these are actually your AV blockers. In your PSVT, you want the AV to be blocked so that the tachycardia is not transmitted. Okay? Yes, Aishwarya. Coming to that. Next time, if the question is the treatment of choice, it's not the drug of choice. What is the treatment of choice for PSVT? It depends on whether the patient is stable or the patient is unstable. Okay, you have to see whether the patient is stable or unstable. Unstable matlab systolic BP less than 90. Okay. Yes, this video will be available for later viewing in app, not on YouTube. If the patient is stable, then you have time, you can do the vagal maneuvers, right? The carotid massage, always it is a unilateral carotid massage, not bilateral anytime. And if it's an unstable patient, you have to do a cardioversion, right? Shock has to be given. So cardioversion basically is to be done for your unstable patient. Okay? So this is helping healing hands. All these questions are FMGE PYQs. So definitely this is for FMGE. Okay? Yeah, I hope everybody is clear with this. So that is your answer to this question. Going to the next question now. What do you think will be the answer to this one now? SI Sharika? Yay, you got the leaderboard. So basically, thank you for someone who mentioned that you could see the leaderboard intermittently. It was basically from my end. वो मैंने डिसेबल गलती से किया हुआ था. I realized just now कि ऐसा भी कोई फीचर है या. %56% got this right. Okay, let's see the leaderboard. Varun is leading, then Garvita, and then Hinata. Okay. Do you remember what is this question basically about? Which of the following drugs, when combined with erythromycin, may cause ventricular arrhythmias? Basically, what is this question about? Great. Yeah. Basically, it is talking about your QT prolongation. Erythromycin causes QT prolongation, cisapride. But remember that this is basically asking about your cytochrome P inhibitor as well. Right? Do you remember the mnemonic for your cytochrome P inhibitor? Your CI wale drugs are cytochrome P inhibitors. Your OM or MO and ON wale drugs, ketoconazole, right, chloramphenicol. So remember, if you combine the two, erythromycin OM, it's also a cytochrome P inhibitor. So if you combine with cisapride, your QT prolongation drug, erythromycin is a cytochrome P inhibitor. It will increase the levels of cisapride. Okay, so yes, you have to think about your cytochrome P inhibitors as well here. Okay, clear with everyone? I hope you remember the mnemonic for inhibitors, the CI, that is your ciprofloxacin, cimetidine, right? Those drugs, the OM, MO, ON wale drugs, and you have your inducers. What was the mnemonic for the inducer drugs? We went in a car to a bar, right? Who gave us the directions? The GPRS. Who were excited about the new bar? The chronic alcoholics, right? So, carbamazepine, barbiturates, griseofulvin, phenytoin, rifampicin, smoking, St. John's wort, all these are inducers, right? We went in a car to a bar, GPRS and chronic alcoholic, okay? Going to the next question, right? This has been asked many times in the exam. What do you think will be the answer to this one now? Calcium channel blocker causing cerebral vasodilatation. Great. Many students are getting this one, right? %71 थोड़े ज़्यादा करेक्ट कर सकते थे. Yeah. Let us see the leaderboard. Varun maintaining the lead, then Garvita and then Hinata. Okay. Calcium channel blocker causing cerebral vasodilatation. Do you remember some question being asked that which is a calcium channel blocker which is used in SAH? This has been asked in the NEET PG exam also recently. So you see how there's the overlap. Subarachnoid hemorrhage में कौन सा calcium channel blocker use करते हैं? Nimodipine. Okay, that is nimodipine. Right? What is the complication that we have in subarachnoid hemorrhage? One of the complication that can develop is vasospasm, and therefore we need a drug which is a vasodilator. And so calcium channel blocker acting on the cerebral vessels is your nimodipine, and SAH you should always remember this. Okay, very, very important, right? Going to the next one. Logical question has been asked in the FMGE exam. What do you think will be the answer to this one now? Logically सोचो ना, मतलब see, you will not know answers to all questions in the exam, so you need to develop those skills of answering very logically. %51 only have got this one right. And let's see the leaderboard. Varun maintaining the lead, then Garvita and then Hinata. Beta blockers are not used in. Did I not tell you just abhi now कि जब adenosine देते हैं PSVT में, the next drug is calcium channel blocker, beta blocker. They are the AV blocking drugs. Tell me the drugs which are AV blockers. What is the mnemonic for AV blockers? It is ABCD. ABCD drugs are your AV blocker drugs. Okay. So remember that B for beta blockers, C for calcium channel blockers, and D for digoxin. That's also an AV blocker, right? So if beta blockers, they cause the AV block, will you use them in the treatment of AV block? No, they will exaggerate the AV block. So obviously they are not going to be used in AV block, right? Essential tremors, पढ़ा जब tremors आएंगे, performance anxiety होगी, propranolol देते हैं, right? Propranolol, performance anxiety. When there are tremors, we give propranolol. So they are used in tremors. Okay. Angina pectoris, why will we use beta blockers? Because angina means the blood supply is less, that creates the chest pain. When the demand and supply is not met, so we tell the heart कि blood supply कम है, so do not exert much. So we try to decrease the contractility of the heart. We do not want the heart to work more so that it does not get the demand is not fulfilled. Okay, so angina mein we do use beta blockers. Migraine prophylaxis. Migraine prophylaxis. What is migraine due to? Cerebral vasodilatation or vasoconstriction? It is vasodilatation basically that leads to migraine. So we want a drug which is a vasoconstrictor. Okay, beta blockers, I hope you remember your ANS pharmacology, again short 5.0, A, B, C, D. Alpha is constrictor, beta is dilator. It is alpha 1 and beta 2. So when you block the beta, there will not be vasodilatation, there will be vasoconstrictor, right? So beta blockers, calcium channel blockers, they are used in migraine prophylaxis because they prevent the vasodilatation. Okay? Beta blockers are also not used in which other heart condition? Beta blockers will also not be used in which other heart condition? Are they used in heart failure? Beta blockers, are they used in heart failure? Yes or no? This is your INICT question as well. Very good. They are not used in acute heart failure. And now when the heart is failing, if you give beta blocker, uska contractility और कम होगा. So failing heart का contractility और कम होगा, which you do not want. Rather you give a drug where the contractility is increasing like digoxin. Okay, so it is an acute heart failure where you will not use beta blockers. Very good, Husna. Second one is your variant angina, not the routine angina pectoris, but the variant angina or the Prince-Mettels angina, where the angina is because of vasospasm, right? It is the vasospasm which is the cause of the angina. By giving beta blocker आप और contraction करोगे तो जो नहीं चाहिए हमको, ठीक है? Right? Clear with everyone? So that is about this one, right? Going on to the next question. Which of the following is not used in the management of bronchial asthma? I hope all of you can see that how the mnemonics that you have learned in short 5.0 videos will help you solve the questions. All these are PYQs. For the new users, please start with short 5.0 in the accelerate folder. It's just like 2 to 3 hours videos for each subject. That's it. You can actually finish it in 3 days. Okay? Try to finish it in the next 3 days. Yes, so 75% I've got this right. Thode questions practice kar lo aur. Yeah, so let's see the leaderboard. Varun is maintaining the lead, then Garvita and then Hinata. Okay. Not used in management of bronchial asthma. So obviously it's going to be a drug which is a bronchoconstrictor. Why are steroids used in asthma? Another question that has been asked. It is not a bronchodilator. Just that it is a potentiator of salbutamol and it is anti-inflammatory. Okay, so we use basically your steroids there. Beta agonist, because we know that beta 2 causes dilatation. Everywhere beta 2 is it causes dilatation. Phosphodiesterase inhibitors increase your cyclic AMP levels. Again, your cyclic AMP increased is bronchodilation, right? Theophylline. So, cholinergic drugs will not be used. Please remember the mnemonic, that is cholinergic. COCO, cholinergic causes constriction. Everywhere cholinergic causes constriction and contraction. Okay? So, rather we use anticholinergic drug. Very good, Husna. Which anticholinergic drug? Ipratropium, tiotropium. Ipratropium, tiotropium. Remember, it is like atropium, so it is anticholinergic and it is your M3 inhibitor. Like atropine, it is anticholinergic, inhibiting the M3 receptor. Okay? So remember, cholinergic causes constriction. COCO, cholinergic causes constriction. Okay? Next one, what is the mechanism of action of xylitol? What is the mechanism of action of xylitol? Thank you, Veena. Those messages in between the live chat. कितने लोगों का सही आया ये? 64%. क्या कर रहे हो? Varun is leading and then Garvita and then Hinata. Xylitol पढ़ा है, short 5.0 नहीं देखा है तो प्लीज देख लेना. Your pharmacology major things are covered in that just 2.5 hours of pharmacology video. All the FMG students watch that 2.5 hours of pharmacology in your short 5.0. Your pharmac is covered. Okay, so xylitol, Z is synthesis. It basically synthesis inhibitor of leukotrienes. Yeah, so leukotrienes are synthesized by what enzyme? Leukotrienes are synthesized by L. It is lipooxygenase. So it is a lipooxygenase inhibitor. Okay. From where these leukotrienes are synthesized? Basically from arachidonic acid. Right, arachidonic acid. One enzyme is LOX, another enzyme is COX, cyclooxygenase, synthesizing your prostaglandins and thromboxane. Okay. Prevents the mast cell degranulation is what drug? That is your chromoglycate. Okay, phosphodiesterase inhibitor used in asthma. That's your theophylline. Okay, that's your theophylline. So remember, please do not confuse your xylitol with montelukast, zafirlukast. Those are leukotriene receptor antagonist. Okay. Next one. I want all of you to get this right. We have discussed this also, the anti-cancer drugs. Which of these is not an alkylating agent? Not an alkylating agent? Smriti, the poll is available in app. I think you were there in app, na Smriti? क्या की वजह से 50% एंटी कैंसर ड्रग्स भी देख लेना शॉर्ट 5.0 में. Right, so let's see the leaderboard. Varun maintaining the lead, then Garvita and then Hinata. ठीक है, great. Not an alkylating agent. जब ऐसा क्वेश्चन आया ना in anti-cancer drugs, just try to hunt for an anti-metabolite. That eases the things for you. If you are able to hunt that one anti-metabolite, you know that it's not an alkylating agent. So बाकी drugs पे दिमाग नहीं लगाना है, right? So remember your 5-fluorouracil. Uracil is a purine or a pyrimidine. Remember, it is a pyrimidine analog. Cut, pyrimidine analog, cut are your pyrimidines. If it is a pyrimidine, so remember that 5-fluorouracil is a pyrimidine analog. Your purine, pyrimidine, folic acid wale are basically your anti-metabolites. Okay, they are the anti-metabolites. So it's not an alkylating agent automatically if I am able to find a anti-metabolite. One other important point about 5-fluorouracil, what side effect does it cause? What side effect does it cause? Thank you, Shruti. It's all these tricks basically that will make the difference. Remember, 5-fluorouracil is the foot. Yeah, very good. It is the hand-foot wala syndrome. Okay. And this 5-fluorouracil is an anti-cancer drug which causes thymidine-less death of the cancer cell. Recently asked question. And this 5-fluorouracil is the one which is hemorrhagic cystitis, is cyclophosphamide Shabnam. Okay. 5-fluorouracil is excreted from the body by, is it excreted by liver, lungs, kidney? By where it is excreted? From where is it excreted? It is excreted by a, very good. So you remember that. Remember 5-fluorouracil, 5-fu. फू करके, इमेजिन फू करके वो लंग्स में से बाहर जा रहा है. सो इट इज एक्सक्रीटेड बाय फू मतलब एयर जैसे लंग्स में से बाहर जा रही है. सो इट इज एक्सक्रीटेड वाया द लंग्स. ओके, सो वेरी इंपॉर्टेंट, दिस इज अ ड्रग एक्सक्रीटेड वाया द लंग्स, 5-fluorouracil. ठीक है, या ग्रेट विपिन, दैट्स द होल पर्पस. ओके, नेक्स्ट वन. Logical question, what do you think will be the answer to this one now? This time I've given you all like one-liner questions because that is what have been asked in the FMG exam. We will have clinical MCQs KBMD also, basically to prime you and help you develop the skills for clinical questions also. Cut, Aishwarya, are your pyrimidines, right? Cytosine, uracil and thymidine. Those are the pyrimidines. 80% have got this right. 79% is what I can see in the poll. Leaderboard, Varun maintaining the lead, then Garvita and Hinata. Leaderboard hill hi nahi raha hai. So, drug of choice for central diabetes insipidus, right? Tell me, what is the clinical feature that you have in diabetes insipidus? Clinical feature in diabetes insipidus is urine osmolality low or urine osmolality high? The urine osmolality is low or high? पीछे से कौन सी आवाज आ रही है? It is low, right? Remember, any diabetes, whether it is diabetes insipidus or it is diabetes mellitus, it basically will have the clinical feature of polyuria. The difference here in polyuria in diabetes insipidus, it is basically decreased ADH. It is all water which is going out in the urine. While in diabetes mellitus, it is glucose in the urine. Glucose is hyperosmolar. So, here the urine osmolality will be high. Water is just pani, dilute cheese. So, remember the urine osmolality will be low. Okay, the urine osmolality will be low. ठीक है? So, urine में क्योंकि पानी जा रहा है, it's a dilute urine and that's why the urine osmolality is less. Okay, that's how you remember that. So, effectively the plasma osmolality is high. अगर यूरिन में ज़्यादा डाइल्यूट हो गया तो प्लाज्मा कॉन्सेंट्रेट हो जाएगा तो प्लाज्मा ऑस्मोलालिटी हाई होगी. सेंट्रल डायबिटीज इंसिपिडस इज वेयर इट्स अ सेंट्रल प्रॉब्लम. दैट मीन्स इट इज प्राइमरी ADH deficiency. In the body, the ADH is not there. So, the only way that we have for treatment is supplement the ADH analog and that is your desmopressin. Okay, that is desmopressin is your ADH analog basically. So, remember desmopressin is what we will use. Desmopressin is like vasopressin. And what is vasopressin? Vasopressin is ADH. Okay, vasopressin is ADH. So, remember desmopressin is vasopressin and that is your ADH. Okay. And if it was a nephrogenic diabetes insipidus, then what will be the drug of choice in nephrogenic diabetes insipidus? Yeah. Nephrogenic is thiazide diuretics. It is thiazide diuretics in nephrogenic diabetes insipidus. And if it is your lithium induced diabetes insipidus, lithium वाले में Li वाला mnemonic याद है? It is amiloride. Okay, it is amiloride. ठीक है? LiLiIL, that's your amiloride. ठीक है? So that's about your, yeah, it's also used in Liddle syndrome. Absolutely right. Li is your lithium and Li is your Liddle. That is where we use amiloride. सबको mnemonic याद है. Endocrine बहुत बड़ा है आकांक्षा. Endocrine में कोई specific topic है where you are struggling? Yeah, so you can let me know. We can take that part in endocrine. Again, endocrine is all about concepts and logics. Yeah, going on to the next question now. We are in the last few questions, I believe. Read the options very carefully. Don't make a mistake. %? कैसे गलत कर सकते हो? ये भी हमने डिस्कस किया है शॉर्ट 5.0 में. हेमंत, ABG एनालिसिस हैज बीन कवर्ड इन अ वेरी इजी मैनर इन द ऐप. प्लीज वॉच दैट वीडियो. शॉर्ट में देखना है तो शॉर्ट 5.0 में देख लेना. ठीक है, उसमें कवर किया है. What is the leaderboard saying? Varun, Garvita, Hinata. Constant. The only constant thing here is the leaderboard. Hydrochlorothiazide acts by inhibiting the sodium chloride pump in the late DCT, nahi, in the early DCT. Okay, my bad, it is early DCT. I hope all of you remember the loop diuretic will act on the loop of Henle, the thick ascending limb, right? It is the thick ascending limb, and loop is your 3, sodium, potassium, 2 chloride. Thiazides is your loop के बाद जब खत्म हो रहा है तो early DCT, इसमें सिर्फ 2 आता है सोडियम क्लोराइड. ओके, इसमें सिर्फ 2 आता है सोडियम क्लोराइड. ठीक है. Meeru, all you need to do to see that pricing of 799 and 1999, click on buy now in the app. You will see that 1 month and 3 month plan. ठीक है. If you are FMG user, take the 1 month. If you are a NEET PG, take a 3 months plan. So please remember this point, very, very important. And also remember, similar to thiazides is what condition, which renal tubular syndrome? Thank you so much, Prashant. Remember, we are in this together. Very good. That is Gittelmann's. That is Gittelmann's is your thiazide diuretics. Right? So remember, in Gittelmann's, what is the feature in Gittelmann's? Extremely low magnesium. ELME. Remember, Gittelmann's has extremely low magnesium. So severe hypomagnesemia. Loop loses calcium. Thiazide does not lose calcium. So there is hypocalciuria, not hypocalcemia. It is hypocalciuria. Okay. So remember, Gittelmann's is extremely low magnesium and hypocalciuria. Okay. Yeah, going on to the next question. Class कब तक है? बस ये last 2 questions है, as you can see. So let me start the poll here and let's start answering this. Logical question है, सोच के answer करना. You will not know answer to all the questions. You have to think logically. You have to rule out the options. Yes, Kirtana, definitely. Start with short 5.0, even though like you are starting now for NEET PG. पहले short 5.0 के subtopics कर लो, फिर उसके बाद PYQs करो and complement with the topics that are not covered from the rapid revision. You can do it from prep ladder. Yes. 57% guys, work on your MCQ solving skills. Okay, let's see the leaderboard. Varun, Hinatha and Dr. Siri. Garvita has gone to the 6th position. So, thoda sa change aa gaya hai leaderboard mein towards the end. And that's why I say the match result can change till the last ball. Hai na? Very, very important. So, that's how the leaderboard has changed now. Right? So, long-term use of which of the following drugs is most likely associated with development of tremors? Abhi dekha tha jab tremors hote hain. In the treatment of tremors, we give beta blockers, right? Performance anxiety tremors होते हैं, ठीक है? So beta blocker तो नहीं है, bitoxolol, timolol तो नहीं है, lol वाले, all या beta blockers are lols, okay? They are lols. Propofol is your IV drug, anesthetic drug. So salbutamol, which is used in asthma, is a beta agonist. Right, it's a beta agonist. It causes dilatation of the smooth muscles, even the muscle के vessels. So इसीलिए tremors होते हैं. Salbutamol का side effect is tremors. Okay, remember salbutamol का side effect is tremor. Another side effect of salbutamol, is it hypokalemia or hyperkalemia? What side effect does salbutamol cause? Hypokalemia or hyperkalemia? Very good, Pratyusha. It is your hypokalemia. So, if you remember, it is used in the treatment of hyperkalemia. Okay, it is used in the treatment of hyperkalemia. That means it takes the potassium in the cell like insulin. So, it decreases the potassium. And remember the third side effect, it causes hyperglycemia. Okay, it causes hyperglycemia. Very good. Right? So, drugs causing hypokalemia, drugs causing hyperkalemia is an important question and a frequently asked question. Okay? Last question for the day. Again, we have seen this in psychopharmacology with the mnemonics. So if you know the mnemonic, this is very, very easy, right? What do you think will be the answer to this one? कितने लोगों का राइट आया है? 64. Please watch the pharmacology videos if you are getting these questions wrong in the today's KBMD. You would see everything has been covered in short 5.0. Right? It is bupropion. It is not venlafaxine. Smoking cessation is bupropion. Absolutely right. So the ones who know the mnemonic, this is very, very easy. Remember, pion says पियो नहीं, बीड़ी सिगरेट पियो नहीं. ठीक है? So remember, in smoking cessation, it is PO nahi, it is bupropion which is used. And what is the mechanism of action of bupropion? ये venlafaxine है, ये varenicline नहीं है. Please do not confuse a venlafaxine with varenicline. ठीक है? Varenicline is the one which is used in your smoking cessation. Varenicline. What is varenicline? Nicotine is your nicotine like. So basically it's a nicotinic receptor, nicotine receptor partial agonist. Okay, partial agonist. ठीक है? And bupropion का mechanism of action पूछ रही थी मैं. What is the mechanism of action of bupropion? Very good, Rekha. It is NDRI. It is the one which is acting on dopamine as well. Yeah, it decreases the threshold for seizures. And remember, it is also contraindicated in people जो बोलते हैं खाओ नहीं पियो नहीं, जो खाते नहीं है पीते नहीं है, that is, it is contraindicated in eating disorders. This is a previous I9CT exam question. So remember, it is contraindicated in eating disorders like anorexia, bulimia. It is contraindicated. तो जो खाओ नहीं पियो नहीं वाला है, basically that is your bupropion. ठीक है? Class on opioid receptors कर लेंगे, है ना? We can do a class on opioid receptors also. Right? So yeah, that completes your KBMD of pharmacology for today. All the questions were the PYQs of FMG exam. So the NEET PG students, if you were struggling with these questions, you got the questions incorrect, please practice the FMG PYQs like a test. So what you can do is, first start with the short 5.0 videos, then go to the PYQs. Whatever topics you see are not covered in short 5.0, do it from your primary resource, whatever you have been reading so far. And then when all of this is done, practice your FMG PYQs as a test. Now to assess like your knowledge. So give your FMG PYQs of that particular subject like a test. Okay? So that was about today. Anatomy Veena, all the 19 subjects except radiology, you will see all the tricks and mnemonics in the Medsynapse app, short app. Okay? Rahul, have you finished watching all the videos for OBGYN surgery? Wow, Vibin, that's super awesome. Only one question wrong, the mnemonics held. That's amazing. Thank you so much for those kind words, everyone. The KBMDs really help. सुमेध, अगर अब तक शॉर्ट 5.0 कंप्लीट नहीं किया है, नेक्स्ट जीटी देने के पहले वो कंप्लीट करो और फिर जीटी दो. ठीक है? कोई बात नहीं शारिका, लेट्स इंक्रीज द स्पीड एज वेल. रिमेंबर, फॉर द एग्जाम, फॉर द लीडर बोर्ड, the speed is important, the accuracy is also important. ठीक है? All the new subscribers on the app, the minimum thing that you should be doing in your short accelerate folder in the app, you have short 5.0, पहले वो खत्म कर दो. That is your target. ठीक है? That's your target. Thank you so much, Dr. Aspiring Avi, everyone. That's amazing. Great. Make mistakes in the class. The KBMDs are there to help you make mistakes in the class so that it helps you not to make mistakes in the exam hall. ठीक है? Thank you so much, everyone. Dr. Ambreen, the FMG students, what they have to see in the app is Short 5.0 and these KBMD sessions. ठीक है, तो Short 5.0 और KBMD देखना है आपको. Shravya, the Short 5.0 videos targeted in such a way you can complete in like 3 days, maximum 4 days. हाँ, पूरा फॉर्मेट देख लेना डॉक्टर एस्पायरिंग और फिर PYQs प्रैक्टिस करना. You would definitely see a jump and an improvement. Okay, so tell me what do you want tomorrow, guys? Another KBMD, is it? Priya, please message on the support number 9922882189. We will help you with the same. Rakesh, definitely. KBMD for medicine. So basically clinical questions are the PYQs of medicine ka KBMD. ठीक है, we'll try to do that. So tomorrow we will have the KBMD and that's going to be in-app only, and we will do the KBMD at tomorrow we will do the KBMD at 12:30 noon. ठीक है, 12:30 noon medicine PYQs के साथ हम करेंगे. ठीक है, yes Hinata, you can. ठीक है, thank you so much everyone, and for all the YouTube viewers as well, if you join late, this is the update. We have launched Short Accelerate, that is your 1 month and 3 month subscription for Short Medsynapse app. Right, it is just an introductory limited period offer which is only for the next 2 days. So if you're planning to attend more KBMDs like this and watching the Short 5.0, make the best of this opportunity, right? It's as affordable as it can be. Okay, thank you so much. Goodbye, take care, and keep studying, keep revising, and keep winning. Thank you.